Have you ever found yourself in a situation where you had to talk about mental health but didn't know how to start the conversation? A seemingly simple question that brings to light the elephant in the room. The issue we often tiptoe around, the topic shrouded in silence and stigma, mental health. This silence, this stigma, it's a barrier. It's a barrier that prevents individuals from seeking help, from understanding their own feelings, and from feeling seen and heard. It's time we break this barrier. It's time we break the silence. Welcome to the first episode of Mind Matters. Today we're focusing on breaking the silence, navigating mental health conversations. This podcast is about more than just talking about mental health. It's about changing how we talk about it, how we perceive it, and ultimately, how we understand it. This silence is what we're going to break today, right here, right now. Meet Anna, a 35-year-old woman who has been silently battling depression for years. Anna's story is not uncommon. She's a vibrant, dynamic woman who excels in her career, loves her family, and enjoys being creative. But beneath her sparkling exterior, she has been grappling with a darkness that she found hard to express. This darkness, a relentless cloud of depression, has been her silent companion for years, an unwelcome guest that refused to leave. In the beginning, Anna didn't even recognize this visitor for what it was. She thought she was just tired, perhaps overworked. But as the months turned into years, she started to realize that this was more than just fatigue. She was losing interest in things she once loved. She was struggling to get out of bed in the morning. She was constantly feeling a profound sense of sadness. It was then she realized she was dealing with depression. But admitting it to herself was only the first step. The next was sharing it with others, and that's where Anna hit a wall. The world, it seemed, was not ready to hear her truth. She encountered stigma, misunderstanding, and a shocking lack of empathy. Friends told her to snap out of it. Colleagues suggested she just needed a vacation. Even her family struggled to understand why she couldn't just be happy. Anna felt isolated. She felt judged. And worst of all, she felt silenced. Society's taboos around mental health had effectively gagged her, making her feel like her struggle was something shameful, something to be hidden away. But Anna's struggle is not a source of shame. It's a testament to her strength, her resilience, her determination to keep going despite the weight of depression pulling her down. It's a testament to the millions of people around the world who, like Anna, are silently battling mental health issues, their voices muffled by the stigma and misunderstanding that still surround these conditions. The hardest part was not just the depression itself, but the inability to communicate her feelings, to express the depth of her despair. Phrases like, "I'm just feeling a bit low," or "I'm just not myself today," didn't even begin to cover it. But how do you explain a darkness that's so all-consuming to people who've never experienced it? Anna, like many others, struggled to voice her mental health concerns, largely due to the stigma and misunderstanding surrounding them. But her story is not a tale of defeat. It's a call to action, a plea for understanding, a rallying cry for us all to break the silence around mental health, to create a world where everyone, like Anna, can speak their truth without fear or shame. Because mental health matters. And it's high time we started treating it that way. So how do we help Anna and others like her? It all begins with how we talk about mental health. Language, the tool we use to express our thoughts, emotions, and understanding of the world, plays a critical role in shaping our perceptions of mental health. It is a powerful agent of change that we often overlook. The words we choose to use can either empower or belittle, enlighten or obscure, heal or hurt. When we speak about mental health in hushed tones, or use derogatory terms to label those who are struggling, we inadvertently perpetuate stigma. This can discourage open conversations, making people like Anna feel isolated, misunderstood, and reluctant to seek help. Consider phrases like "snap out of it" or "it's all in your head." These phrases imply that mental health issues are a choice, a sign of weakness, or simply a figment of one's imagination. They invalidate the very real struggles that individuals with mental health conditions face every day. Instead, we should strive to use language that fosters understanding, empathy, and respect. This could be as simple as saying "mental health condition" instead of "mental illness," or "person with depression" instead of "depressed person." Such language places the person before their condition, emphasizing their humanity, not their struggle. Moreover, we can use language to encourage dialogue about mental health. By openly discussing our own experiences or asking others about theirs in a compassionate, non-judgmental manner, we can help to normalize these conversations. We can show that it's okay to not be okay, and that seeking help is a sign of strength, not weakness. In essence, language is more than just words. It is a reflection of our attitudes, beliefs, and values. By changing our language, we can change the narrative around mental health, challenging stereotypes, reducing stigma, and creating a more inclusive, understanding society. Changing our language is the first step towards breaking the silence. Now you may be wondering, how exactly do we start a conversation about mental health? Well, initiating a conversation about mental health isn't always straightforward. It requires thoughtfulness, sensitivity, and a whole lot of courage. But don't worry, we're here to guide you through it. First and foremost, it's essential to create a safe and non-judgmental space. This means choosing a comfortable and quiet setting where both parties can speak freely. It's about ensuring the other person knows that they're in a secure environment where they can express their thoughts and feelings without fear of judgment or criticism. Equally important is the timing. It's best to pick a moment when you both have plenty of time to talk, without any rush or interruptions. This way, you're showing that you truly value the conversation and are willing to give it the time it deserves. Now, when you're ready to start the conversation, it's crucial to use I statements. Instead of saying, "You seem depressed," try saying, "I've noticed you've been seeming a bit down lately." This approach is less confrontational and leaves room for the other person to share their feelings. Remember, it's not about diagnosing or offering solutions, but about opening up a dialogue. It's about saying, "I'm here for you. I'm ready to listen." And that brings us to our next point, listening. It's one of the most powerful tools we have in these conversations. It's not just about hearing the words the other person is saying, but truly understanding them. Show empathy, validate their feelings, and resist the urge to interrupt or offer advice unless asked. Let's not forget the importance of body language. Maintain eye contact, nod to show understanding, and lean in slightly to show that you're engaged. These small gestures can make a big difference in making the other person feel heard and understood. And what if they're not ready to talk? That's okay too. Let them know that you're there for them whenever they feel comfortable to open up. Sometimes, just knowing that someone is there to listen can make a world of difference. Finally, it's crucial to respect their privacy. If someone confides in you about their mental health, it's their story to tell. It's not for us to share with others without their permission. And above all, remember to take care of your own mental health too. These conversations can be emotionally draining, so it's important to seek support for yourself as well. Starting a conversation about mental health may not be easy, but it's a crucial step towards breaking the silence. And remember, you don't have to be an expert to start these conversations. All you need is to be kind, patient, and willing to listen. Because sometimes what people need most is just someone who's willing to sit beside them in the silence, reminding them that they're not alone. In our journey today, we've seen how silence can be a barrier to mental health support. We've delved into the powerful story of Anna, a testament to the resilience of the human spirit and a stark reminder of the struggles many face in silence. Anna's story has underscored the urgency of breaking the silence, of reaching out, and of extending empathy and understanding to those grappling with mental health challenges. We've also explored the immense power of language, how it shapes our perceptions and attitudes towards mental health. We've seen how the right words can create a safe space for dialogue, can inspire courage, and can help dispel stigmas. Finally, we've provided practical advice on how to initiate these vital conversations, emphasizing the importance of active listening, patience, and respect. Remember, your words have the power to break the silence around mental health. Let's use them wisely.